All right, welcome everybody back to the Green Party series out of Illinois. We have a very special guest tonight, a very interesting topic, much needed discussion on a very important topic.
Mhm.
We have Joy Bunton. Bunton? How do I
Yes,
spell
Bunton.
Bunton
Bunton.
and Nimesh Patel. Welcome to the show, everybody.
Mhm.
I'm your host, David Rich. Calvin is hanging out with his family, taking a little vacay. So, Calvin, if you're here, hope you're having fun. We're going to be talking about Medicare for All today, and this is a very important issue. July 24th, I believe, is the national rally concerning that issue. People are gathering in front of the Capitol and all over the country. It turns out. There's something happening here in Chicago, of which I know Joy, you and Nimesh, you are big parts of getting that together, correct?
Yes.
Correct.
Okay, well, let's, without further ado, I know hopefully we're having a Dr. Pam come on here soon. I know she got caught up in a different meeting, as doctors tend to do. So hopefully she'll show up soon. So Joy, why don't you go ahead and just tell us about yourself, how you got involved in this sort of thing, and tell us about the July 24th Chicago
Mhm.
situation.
Sure. Well, I've been passionate about Medicare for All since possibly before Bernie ran in 2016.
Oh, yeah.
And I've been attending PDA's weekly healthcare emergency town halls on Sundays. And I've just been following all kinds of different accounts, like on social media that have to do with Medicare for All. And so I just thought that I've just been passionate about it for a long time. Plus, I have my own personal medical condition that I have to deal with. And my health got so much worse when I had lost my job and I couldn't afford Cobra. And the
Oh,
medications I was on, because I have polymyositis, which is a rare autoimmune neuromuscular disease, and it also caused me to have mild interstitial lung disease, which
oh,
makes me
wow.
high risk for COVID as well.
Oh, yeah,
Which is
sure.
like, oh, great. I have this rare thing where the common medication to treat the interstitial lung disease caused my bone marrow to be suppressed. It was azathioprine. I lacked this TPNT enzyme, so I was in the hospital and I almost needed a bone marrow transplant. All
Wow.
these terrible things before I had lost the job. But when I had lost the job it's like I couldn't afford the Cobra and I couldn't afford the immunosuppressants. I could still afford the prednisone, but the immunosuppressants were much more expensive. And I just couldn't afford those. I was just like, well, maybe I can write it out with this prednisone, and it wasn't working. And apparently, when you're on unemployment, you don't qualify for Medicaid. They think that's just too rich. So, so I got into big trouble until finally the unemployment ran out, and then I qualified for Medicaid, and then I was able to go back and see my rheumatologist, who I need to see because it's a rare condition and I need a specialist. And so, fortunately, at University of Chicago, they take Medicaid patients, and so thankfully, he's able to help me so I could get better. I'm still not perfect because I'm on. I applied for disability because I'm still not working. Applied for disability, it was denied, and I applied for a appeal hearing, which I'm waiting for to get a hearing date for that. So, oh, I would love to have Medicare for all, in which I don't have to worry about being employed, or if I was in a state where the Medicaid wasn't as expanded as it is here, and all of this stuff. So I want me some Medicare for all, even though right now the Medicaid is helping me a lot. But with far as how I got involved with the march, my friend Renee had connected me. She had met Sharif, who's the brainchild of this march all around the country, and I guess they were thinking about Chicago, and she was like, "Contact Joy. She knows everybody." I don't really know everybody, but it's a cute thing if people say, because I do know people, or some people happen to follow me, but I'm not gonna make it seem like I know them or they know me, because
Well, yeah, you're well connected.
I'm semi-connected. Semi-connected, but it's taken a lot of follow-ups and pushing to try and get these organizations to get back to me, because I can send a DM and then no one no one reads it. Or if someone says, okay, we pass it on, but then I'm like, well, would you pass it on to? Who can I contact to say, where is it at now? Who do I need, just to follow through to finally to close the deal and get them on board. So
Right.
that's how I got here.
Well, okay. I mean, that's an unfortunate way to get involved in this, but it's very makes a lot of sense. Obviously, you start drowning in medical bills or get denied coverage because you can't afford it.
Exactly.
I gotta kind of be not so pleasant right now. It's ridiculous that the richest country in the world, how it treats its citizens. I mean, it's just on so many different levels, not just this one, but in so many different levels. But this one especially. I mean, like it's just kind of a no-brainer that you should provide health care for everybody.
Right.
And equal access and equal treatment. It's
Thank
really,
you.
really, it's highly offensive that if you have more money, you deserve better health. That's just stupid. Sorry, Nimesh, go ahead. That's my rant. I'll give you another rant later. But it really makes me angry. It really does. It's because it's just so dumb. Nimesh, sorry, go ahead. How'd you get involved in this whole thing?
Well, I heard about this march happening in Washington, D.C. on July 24th. And that was, I think, the organizers wanted to do that in Washington, D.C. only. Then other cities started signing up. I contacted the organizers and I thought, oh, has anybody expressed interest in Chicago? And they're like, oh, yeah, a few people have. And I said, oh, interesting. And initially, I just wanted to sit on the sidelines and just like, okay, it's happening, let's do it. And then, talk to Sharif. He's, one of the organizers of this thing in Washington, D.C. Ricky Dunlop, he's also one of the people there. And I think Gene Lafferty. So these are all people from the East Coast. They started it over there and said, oh, you know what? You should, uh, you know, you should get, we'll hook you up with some people. And this is, you know what? Introduce you to Joy. And then we got the ball rolling. I mean,
Great.
This is going to be an annual thing. So.
Oh, cool. Oh, right on. Yeah, don't let Washington. Don't let them.
Yeah. So
don't let them forget.
Yeah. So mark it in your calendar.
July 24th.
And this is going to build on itself.
Good.
So this is going to build on itself. And
good.
This is a big umbrella organization. I vote green whenever given the opportunity to do so.
Well, that's good.
Because I'm done with the
duopoly. Yeah, exactly. The state of the nation and most of the world brought to you by 150 years of Democrat and Republican rule. Congratulations, everybody.
And it just, people say, "Oh, well, they don't win." I'm like, well, you got to build up that power.
And this whole I don't vote third party because third parties never win. Well, they don't win because you don't vote for them. And individuals don't vote for third parties because they don't think enough other people will vote for them. It's a self-defeating, self-fulfilling prophecy. I mean, you're talking yourself out of it because you think everybody else is talking yourself out of it, but they're doing it because they think you are. It's kind of silly. The Green Party platform is the best platform out there in any given party in America, guaranteed. And that's again, you read the 10 platform positions, and it's again a no-brainer. I just want to say real quick a shout out to somebody who's on the private or the comments here. Michael sucks at football. Says hello. Well, then try baseball, Michael. That's another sport, a little easier. So thanks for joining us tonight. So why don't you tell us about what is the march going to look like? Where did this start? Where are they gathering? What streets are they walking down? That kind of thing, or is it just in front of a building? Well, how's it going to look like?
Well,
Anyway.
Go ahead, Joy.
I was going to say that we have focused on definitely having a rally at Daly Center. In our meetings, there's some people who are suggesting that we walk to do a march to the Blue Cross Blue Shield Illinois building. We haven't had an official vote on it. It's just something we're deliberating. So I don't know if it'll actually happen because we also have to just deliberate as to getting a permit for that because we're trying to figure out getting the permit for the Daly Plaza. So it's still in the works as to whether or not there will be a march. I was wondering whether or not we might want to do a caravan even. I understand that I think New York might be doing a caravan on a previous date to help build up to the rally or march that they're having. So I was like, it's a possibility. We're still entertaining different ideas.
Okay, cool. So, but probably. So, what is it like to get? It always kind of struck me as, I don't know, odd or peculiar that you have to get a permit to protest. I mean, like asking the government's permission to like call them out on something, you know.
Right.
But I get it. I mean, they want to maintain safety and nobody gets hurt, and they don't have people, you know, running around everywhere being crazy. So, what is that process like? I'm just curious, just real quick, getting a permit for a protest.
Nimesh?
Well, it is sort of cumbersome. You guys hear me now, right? Because I think I see
Still low, but
it's still a little low.
Can you make it louder?
I'm gonna switch headphones.
Okay.
Oh, okay, great.
So give me about 2 minutes. I'm gonna switch.
Okay, Joy. So, what do you think about the whole getting a permission?
Sounds like a pain in the butt because I've been handling that, and so apparently on the form, which I haven't seen a copy of the form, or I can't remember seeing a copy on there somewhere. They want you to say that you accept liability if something happens or something. It's like, what? What's that stuff going on there? Like, I don't understand what all that is, and so
yeah, I don't get that either. Like,
I think then there's a couple other people that are hoping to use it at the same date, and so we're trying to hope that we can negotiate something where maybe they can give up and let us have it. So, hopefully we can work that out, because I think that would be a good place, unless you have any suggestions for as a plan B somewhere else that we
I don't know.
consider.
I don't know enough about Chicago. I live in the northern suburbs. No, I live in the suburbs. Yeah.
Oh, okay.
I lived in Portland, Oregon for 12 years, and that's about as big a city as I can handle. And it's a very small city. Yeah. So
I've heard good things.
oh, Portland's beautiful. So okay, let's talk about just Medicare for All as a topic in general. So, there are a few arguments against it, and I found every single one of them wanting. They don't hold up. Like one of them is just like the United States is just too many people in there to hold that sort of a centralized system logistically, which is just purely speculative, and there's no evidence to support that. And if it is too complex from a centralized position, there's ways of just reallocating the central to decentralize it. Just make a federal law that the states have to provide it, or making a federal law that each county has to provide, or something like that. It doesn't have to be necessarily Washington running the whole thing. And there are different types of, like, let's just say, single payer or socialized healthcare systems. For example, in Canada, the government just sort of acts like a giant insurance company. It collects the money from the taxes and allocates it. But the entire, like the hospitals, the clinics, the doctors, that's all private market stuff. It's not like it's owned by the government. There's different ways to allocate to configure the entire system. It doesn't. Everybody's like freaking out, like, oh my God, the federal government's going to take over every single decision we ever make, and it's not necessarily the case. Nimesh, go ahead. I mean, what do you think about how do you envision single payer in this country? Can't hear you.
Is the mic? Is there a switch for the mic?
Still nothing. Can you hear us? Yeah, we're not getting any volume.
Uh-oh. Oh, man. You still have the other headphones? Low is better than nothing.
Yeah, exactly.
I could have sworn Blue Cross Blue Shield of Illinois used to be nonprofit once upon a time.
Gee, that would be a good start.
I don't know what happened or why if that's true. I don't know why. Well, I guess I know why they went to profit. It's like, forget nonprofit.
Because no profit, no capitalism. No, we can't hear you, Nimesh. Yeah, maybe the other headphones would be better. I mean, even if it's low. Another Bluetooth. Okay, cool.
Thanks for trying.
Yeah. So Calvin is obviously sitting on the side checking out the show. Hey, Calvin, what's up, buddy?
Hey, Calvin.
Yep, and the UK's is nationalized healthcare instead of nationalized healthcare insurance. Right, exactly. It's just, there's all sorts of different ways of doing it. The important thing is to do it. Number one thing is equal and full access to everybody.
Right.
And make it efficient as you possibly can.
Sounds good.
Just because, everybody thinks that socialized anything is like a complete waste of money, and that simply isn't the case.
Mm-hmm.
That's one of the criticisms against it, is that, this comes from like, what is that libertarian think tank, Cato, the Cato Institute? Cato.
Oh, yeah.
Of course, they hate anything government, and I'm not a big fan of governments either. But I mean, when you need them, you need them. But they think that it would just be an absolute waste of money. Now, every study that I've looked at concerning the efficacy and fiscal efficiency of a centralized system actually says that we would be saving overall 40%. On top of, from what we're spending now. We spend so much. It's a massive amount. That's almost a 50% reduction in cost.
Yes.
Yeah, it is crazy. Nimesh, are you with us, buddy? Can you hear us? No? Okay. Joy and I will keep chatting. It's pretty crazy. And the whole, just the inefficiency of the insurance industry in this country, it's this middleman along the way of paying for stuff, and it's just become monstrous. It's just I remember going to my doctor a couple of years ago, my GP, and whatever it is we were talking about, she wanted to give me X, right? But she said, but I can't because the insurance companies won't let me. I'm like, are you kidding me?
No.
I'm like, you're the doctor. She's like, the insurance companies get the final say because they're flipping the bill. Oh, absolutely. No, you can say asshole.
Asshole.
Yeah, exactly. It's ridiculous. It's absolutely ridiculous. I mean,
yes.
Isn't that practicing medicine without a license?
It seems
And
like
isn't that illegal?
Yeah, it should be. It's
Nimesh, don't get hear you. So, it's pretty crazy. Calvin, there we got you. Yay!
Oh, you know what it was?
Tell me.
You're not going to believe this.
What?
You had the mute button on.
It was the mute button.
That'll do it.
And I'm like, I switched through like 3 or 4 headphones. I'm like, what the heck? Okay. Well, it's okay. It works.
We're back. Yeah, we're back.
Yay.
Okay, cool.
Yeah.
So go ahead. I mean, you catch up.
Yeah. The 2 biggest questions. I mean, look, we've had 40 years of right-wing propaganda telling the American people 2 things. It costs too much and it doesn't work.
Right.
Okay. So when it comes to the cost, we just got to make it simple. I think, I told the organizers, we got to put up a little calculator. Medicare for All is a 4% progressive income tax. You pay at the end of the year. Your first $29,000 is exempt. So if you work, like let's say somebody says they work at Taco Bell, they make $26,000 a year. You're going to pay 0.
Right.
If you make $60,000, now after $29,000, you're going to be paying 4%. It's going to be about $1,300 a year. Okay.
Wait, how much a year? I'm sorry.
$1,300 for the whole year. It's 4%. 4%.
People are paying that per month.
Yeah, exactly.
Yeah, with families.
Yeah. And as to how it works, the money, the government pulls the money together. I mean, there's going to be some people, you're going to go through life 30, 40, 50, 60 years without any health problems. Then you know what? God bless you.
Yeah.
And unfortunately, some people will have health issues. And that's where everybody's money comes into help. Just like the public library, just like the fire department, just like the police department, just like the military, everybody contributes for the common good.
Right. Yeah, exactly.
And when people say, gee, it doesn't work, and I'm like, you know what? I actually have a group of friends who live in Canada, and I always tell them, you know what? I'll forward you their information, have a chat with them. And because of social media, they're able to say, like, this person is A, real, They joined Facebook in 2002. This person's a school teacher. She's got a family, and she's saying this is how our healthcare system works. So, this is like one way to combat the propaganda, because this, you know what? This is going to be a public relations war.
Oh, it really is. Hold on a second, my camera's all messed up.
So, let's not forget, we're going to have, for those people who do remember, we're going to have another, Harry and Louise commercial, okay? That was a famous commercial when the Clintons tried to, reform healthcare, and the insurance lobby had this very famous public relations commercial called Harry and Louise. They were sitting at the kitchen table, paying the bills, and saying, how do we pay this healthcare? And now they want to do this. We can't afford it. So they scared the bejeepers out of the American people.
Yeah, no, absolutely. It's when I hear about people going into debt and their credit rating takes a tank because they can't, they have so much debt and that kind of thing. And then I know a friend of mine who got into an accident, I don't know, maybe 15, 16 years ago, and he has to live with his parents. He owns his own construction company. He makes tons of money, but he has to live with his parents because he can't really afford anything because of how much debt he is.
Wow.
He said because he didn't have insurance at the time. It's ridiculous.
That is crazy.
Yeah, I think what the right side of the political spectrum isn't understanding is that when you have things like this that are so expensive that everybody needs, you're actually ruining other markets, because now that people are burdened by this sort of debt, they can't spend money. They can't go out to the restaurants. They can't go out to bars. They can't go out to movies. They can't. So all of a sudden, they can't buy nice cars or whatever else, or houses. So other markets start suffering too, because you put such a burden in this one. So it's economically, it's really stupid.
Yeah. You can't start a business.
Yeah.
You can't start a business. That's the pitch to a lot of conservative people. You can't start a business. And you know what? If you did start a business, and you know what? The odds are actually against you statistically. And you know what? If your business failed, guess what? You still have this basic, essential human need.
Right.
This basic human right.
That's right.
Okay, good point. Let's talk about that, because a lot of people say, look, healthcare is not a right. Sorry, it's merit-based just like anything else. What do you say about that? Obviously, you think it's a right. You just said that. But why do you think it's a right?
Well, you need healthcare to survive. You need healthcare to have a good quality life. But not only that, we really need to bring back the conversation, the public discourse in our country. FDR talked about the 4 freedoms, right? And freedom is beyond just political rights. It's economic rights as well.
That's right.
We live in a world where, these things are possible. If we lived 1,000 years ago and somebody said we could provide food for everybody, look, it wasn't possible. But today, healthcare being provided to every person is possible.
Right.
It's not pie in the sky.
No, it's not. And most other nations have some form of single payer, one way or another. And here's another interesting thing too. So, America likes to pride itself in being number one or at least top 10 in the world of whatever, right? So we're number one in military power. That's great. We can blow up the world 18 times over. Good for us. We have the most amount of people in jail than any other country in the world. Again, good for us. And I think we rank number 6 in the world for cop killings per year. That's great. With healthcare, we rank 16th or 17th or something like that. The top 10, first of all, the number one, the highest rated healthcare system in the world is Canada's. And all the other 9 up to top 10, they're all single payer in one way or another. And again, there are different types, manifestations, expressions of a single payer system. It's not all just one simple thing, meaning that the federal government really owns everything. It's just more of a matter of it sort of it makes sure that these things are happening, that things are being provided. So my point is that if we want to be the number one and everything, we have to go single payer. It's just never going to happen with the healthcare system. We're always going to rank lesser than the top 10. But we can say we spend plenty of money on military, and we spend more money on killing than we do on health. and we could probably just cut the military budget by like about 10% and probably pay for everything ever. So, it's just a completely bloated thing. So, what do you think about? I mean, so Biden seems to have this hybrid idea. He thinks that give people the ability to keep their private insurance, if they want to, because he's like, some people like their insurance company. Who the hell likes their insurance company? Anyway, but if you don't want to do that, you can just jump on a government plan. What do you think about that as an option?
My first job was with Blue Cross Blue Shield, actually.
Oh, cool.
And at the time, I was healthy and young and didn't appreciate having great healthcare insurance, but and I didn't appreciate being in a union at the time because the employees have to have their union. But 35 is when I got that rare autoimmune neuromuscular condition that very few people get, and you have to always tell them how to spell it. No one's heard of it before. And I wasn't at Blue Cross at the time, and I'm paying all this money for specialists and trying to get the highest like PPO, so I don't have to keep going through these referrals and everything, and paying all these co-pays, and it's just the worst. It's just the worst. We need Medicare for all. It's just crazy.
Because I think a lot of that 40% cost efficiency, what we would be cutting out is a lot of administrative costs. There's just so many tiers to the bureaucracy, including especially in the insurance industry. Plus they're for profit too, so you'd be cutting that out. So I could easily 40% makes a lot of sense to me in a lot of ways. And that's what do you guys think of Obamacare? Because at first I was like, oh, this is great, this is a great thing, and then I realized it's really nothing more than an insurance mandate. And I definitely don't. Let me get a little libertarian out of you here. I definitely don't think it's the government's place to allow privately owned businesses to make a ridiculous amount of money through the law. That's you don't get to pick and choose what markets where that kind of thing. You're going to be billionaires because we're going to go ahead and make people buy your stuff. Anyway, but what do you guys think about Obamacare?
Did you want to go first?
Nimesh?
You know what? I'm keeping my eyes on the prize, Medicare For All.
Okay.
I mean, because there's so much confusion out there.
It's crazy.
I mean, like I drove past like Belmont and Austin, and there's like a couple of these like insurance people, or they're independent insurance people, and they still have the Obamacare signs up. So, because I mean that's what it's that's what it's known as, right? I mean, on the street, personal vernacular, etc. It's just known as Obamacare.
Yeah.
And so we just gotta tell people, what? It's an improvement upon it. Oftentimes, oftentimes we gotta use the conservatives' thunder, because haven't you noticed they're always improving things? They're always reforming stuff.
Conservatives?
Yeah, conservatives are always. Yeah, I mean that's what they're saying. That's what they say to people. We're all.
They say they're doing what they're not.
The very definition of conservative is lacking change. I mean, not wanting to conserve something is to keep it the way it is. I don't see how they're fixing anything.
Right.
No, I know what you're saying.
Yeah.
And so that's what we have to do. It said, hey, we just want to improve capitalism. We want to make it better work for you. We got to steal their thunder. Otherwise, we're going to lose.
Yeah, we definitely need to have a show on capitalism too. I mean, that whole economic system is just stupid too.
It's expensive.
It's just ridiculous. It's the reason why 1% of the population has like whatever it is, 75, 80% of the wealth. That's because that's what capitalism does. Period. Okay, that's the private capitalism. So a lot of people have this idea that capitalism means a free economic system. It doesn't mean that. Capitalism means an economic system that includes the private ownership of capital. That's what got its stems from. So where the workers give up the rights to the ownership of their own property, and they have to give it to the employer. And then they give them pittance, and then we're completely subject to them and whatever they want to do, which is ridiculous. Anyway, that's okay. So, Nimesh, can we keep you on for a little bit longer? Or you got to go.
No. You know what? I'll stay.
Okay, cool. Talk more about the protest, the rally, if you will. Have you talked to people from other cities? Have you talked to anybody outside of Chicago? How many people do you suspect will be at the Chicago one?
Well,
is this something you sign up for? Like, where are people finding out about this?
Go to the number 4, the letter M, number 4, all.org.
M4A. Okay.
For all.org. I think we're going to have to make it simple, like March for Medicare for All or something like that. But that's the website for now. And it's almost like every week, more and more cities are signing up.
Yes, we're doing.
Okay, folks, if you're watching, here's the address you can go to: https://m4m4all.org. Okay, very cool. In your estimation, have you guys been activists in other things? Have you marched on the streets for other purposes, or is this your first one?
No, I've marched on, for other things. Help formulate direct action. Create a tenant union in our own building.
Oh,
so,
great!
Oh, great!
Have experience, and you know what? That's like the next frontier. I think, a tenant association, tenant union, because right now, guess what? Majority of the country are now renters.
Oh, that's another one. We should talk about landlords someday. Yeah, charming.
Yeah, but you know what? That's a great way. That's a fantastic way to get people directly involved, because you know what? Hey, you pay a rent check every month, right?
Yep.
Would you like, a better deal? Would you like more rental power? Would you like to have influence? Well, you can have that if you join with your fellow tenants, people that you already know.
That's right.
I love that. That's a great idea. Absolutely. I mean, if people would just collectivize in any given area of the economic system, you'd see it have massive. If people would realize that we are the majority of the population, we have the most power if we just get together and do it together. You can change so much. That's right, Calvin. Housing cooperatives, absolutely. You can change a lot of things in this country and worldwide. Oh my God.
Yeah.
It's crazy. I mean, when employees realize that, especially now, but always the case, but definitely now, I had a conversation with my boss a couple of years ago. I'm like, and it was just a hypothetical thing, even though it's kind of an illustrated point too. I'm like, which scenario do you think would happen quicker? I walk out of here and I find another job of equal or greater pay in a day, or you fire me and you find somebody of equal or greater skill. He's like, the first one. I'm like, absolutely. I could go get a job in 5 seconds like that, because I've, that kind of thing. And when people realize that, employees realize that they do have that power, and they can start making certain reasonable demands from their employers, 100%.
Yes.
Right? And it's unfortunate that it has to get to that. It's unfortunate that we have to do this to get to a point of just a rational situation like that. I mean, why can't of course, the whole point of opening a business is to make an income for yourself, provide goods and services to the public, and to create jobs. And nobody seems to want to add that last one in there.
Yeah, create jobs. Absolutely, like caregiving and all that stuff.
Yeah.
Yep. And you know what? Oftentimes, doing those strategies is like a good way to sidestep the politicians, sidestep the entire electoral process. Because last year, if you haven't noticed, everybody was telling the public to go out and vote, right? The Gap had commercials saying their models with their blue jeans dancing and telling you to vote. Dunkin' Donuts were saying, get out and vote and get your free donut. And McDonald's had commercials. And I just think you know what? It just seems like corporate America is trying to legitimize an illegitimate system.
Yeah.
And so
that's a good point.
Yeah, voting is a strategy, but it's just one.
You definitely need to do more than just vote. Just voting itself is not enough, especially not these days.
I think it was Henry David Thoreau who said, "If voting did anything, it would be made illegal." I think it was HDT. Anyway, so what do you think about protest? The history? Have you guys ever gotten into like the history of protests and that kind of thing in America? I read a little bit about it. I read a lot about the labor movement and the things that happened there. Because a lot of people are like, protests don't do anything. It's kind of ridiculous. And then I bring them back to the 60s. And there was supposedly a conversation in the White House at some point where, like, if they didn't start de-escalating the amount of troops in Vietnam, somebody in a higher up rank, I can't remember the name, it wasn't the president, said that I can't guarantee the safety of this nation because everybody was just freaking out. Now, that's going beyond just mere peaceful protests. Obviously, your safety is threatened. It means violence is occurring. Think of last year, what happened. Like, a lot of people on Facebook were posting things like, they would show a picture of like, an area of a city burning down or something like that. And then they just show a picture of Derek Chauvin guilty. Like, you need this to do this, like that kind of thing. So do you think peaceful protests are really an accurate, efficient, effective way to get change happening?
I think it's similar to voting. I think it's similar to voting in that just in and of itself, it's not. But I'm basically just for everything but the kitchen sink. Just any.
You fight on multiple fronts. You vote, you protest, you write letters, you proselytize, you host Green Party series shows. You do, all that sorts of stuff. Yeah, right.
And
you
never stop until and even when you supposedly get something, because it's usually you're not going to get everything you want in one go. So if you get something, you just keep going. And even if you get everything, there's probably still more you can still fight for it to keep, from there. So I think it's just a never-ending things. I think what I was thinking in terms of why I got involved was, one, my personal goal is for this Chicago one is to be the biggest turnout. I'm just hoping. I want Chicago to be the biggest turnout, especially since it's the one safe blue state where neither senator supports Medicare for All. And we have neither one. In the safe, New York has one, Gillibrand, and California has one. Was it Becerra? What's his name?
California doesn't support it. It's like the most
California has just one senator of the two because Feinstein doesn't. So the new guy, he supports it, where he co-sponsored it anyway.
Okay, so talk about the two Illinois senators that don't. This is a bit. Okay.
Dick Durbin
and Tammy Duckworth.
Neither one of them have co-sponsored Medicare for All. And it's a pandemic and nothing. And there was like that emergency one that Bernie did for COVID, and they didn't sign on to that either. And when Durbin ran, there was like a Green candidate and an independent candidate, and he just one-handedly, I think a lot of people just presumed that he supported even though he doesn't, and there weren't enough people saying, look, you should support it.
Do you know why they don't support it? Have they said so?
Yeah.
This right here. Just follow the dollar.
Yeah, it's probably donors. Donors probably have a lot to do with it. I'm not sure how much of it is farm.
Insurance lobbyists and that stuff?
Yeah.
Insurance lobbyists are just...
I'm pretty sure that's something to do with it. Yeah.
They're so disgusting.
And it's so popular. So that was one of the reasons why I was hoping that if we could get, a big turnout and get a lot of attention on it, and then people start realizing, oh, our own senators, neither one of them support it. That's just ridiculous. It's just an outrage to me that neither one, it just pisses me off that neither one of them.
It really did. No, I agree. It makes me angry. It just boggles my mind. Yeah. And it's at the cost of people's suffering. That's what we're talking about here. Exactly. So as far as going back to healthcare as a right, the argument against that is that a right is an abstract, it's a value, it's a virtue. A right by definition is a moral allowance for behavior. So it has to be morally acceptable for you to have the right to do it in the first place. Okay, I understand that. Okay. So like healthcare is not it's not one of those things that's too commodity based and that kind of thing. But health itself is just more of a generalized value that we do have a right to. We have a right to be healthy. That's why the environment and safety and cleanliness is important and that kind of thing. So what you do as a rational civilized society is you make an industry that is actually providing you the access to that right. So, I mean, you might have to take a couple steps to get to the point where, healthcare as an economic system or as a market is a right. But you just by saying that health itself is a right. I've never heard anybody say that isn't the case. Like, no, you don't have a right to health. Everybody says you have a right to health. So then we build a system that allows for you to get that, to obtain that right. Just like, you build voting places and, voting machines like that because you have the right to vote. Same sort of thing. These all that stuff costs money. These are all commodity-based things. And, it's important also to remember that people are not commodities. You don't get to buy and sell people.
Right.
And that's where...
Because that's the libertarian position. They want to treat the whole damn thing as this commodity-based crap. I had a libertarian on my radio show, and he kept saying that. I'm like, people aren't commodities. He's like, but they should be. I'm like, stop right now. I'm like, you don't get to... Yeah. I don't think he was fully understanding that he was advocating slavery.
Thank you.
I'm like, you need to think about what you're saying. You don't get to buy and sell people. Oh my God.
I mean, when these libertarian types, right-wing economic types,
right,
start going there, you got to ask them, wait a minute. And they love using the word market. Market is who? It's us, the people,
right.
The relationship that we have amongst ourselves.
Yeah.
That's what your beloved market is. And then, when we pivot to the conversation of, is things like healthcare a right? How about a job? Is a job a right?
That's interesting. So unionism is based on the right to work, and bringing democracy to the workplace. So a lot of people say you don't have a right to a job.
Yeah.
Of course you do.
And you know what? Let's get to that frame of argument, and then let them say no, it's not.
Right.
And they're the ones who are going to be looking silly because they act like work. They act like they patented the word work, and when it actually comes time to saying, you know what, let's there's plenty of work to do. Oh
yeah. Oh, absolutely.
It's still plenty of work.
Economist Rutger Bregman.
Okay.
He wrote a book called Utopia for Realists.
That's interesting.
Yeah.
It's called Utopia for Real, and he just pointed out that one example. He says the population of the world is aging. We need caregivers.
Yes.
He's like, we need universal pre-kindergarten. We need teachers' aides, assistants, etc. That's just two places where he showed, take care of our young, take care of our old.
Yeah.
And he's like, it's not. And then of course they're going to mock the whole idea by saying you're going to pay a guy to push a broom back and forth. Ha ha. No, and you just give out those actual examples.
Yeah.
Yeah, no, for sure. No, yeah, no. So, the libertarian notion of economics. I was actually a part of the Libertarian Party until I came over to the Green Party because I realized how crazy the libertarians are. I had a very different understanding of what libertarianism was than the American version of it. And by the way, the American version is different than what libertarianism means everywhere else in the world. Yeah, no, and I'll forego it. I can talk about this for hours,
like everything else. But you know what?
Right.
I think earlier, a few minutes ago, you brought up what do we think about this protest or if it's effective or not? I just want to remind people that the way movements start is people got to be moving first. Yeah. That's why they're called movements.
Yeah.
Number one. Number two,
anything,
like anything else, things build upon themselves.
Right.
And so I understand you show up somewhere and 30 people come and you look around and you say, oh my God, only 30 people came. That's fine. That's a start.
Absolutely.
If you look at the Vietnam the Vietnam peace movement. It wasn't the Vietnam anti-war movement. It was the Vietnam peace movement. When they started, they had little to no public support.
Right. And then look,
then
it became like a pivotal cultural point in our history. Like it changed everything.
You had like 40% of active duty military personnel wear black armbands.
Oh, absolutely. Yeah, you want to ask somebody, you want to find somebody who's anti-government and anti-war, find a veteran.
Yeah, and then you had veterans in their uniform going into the front of the line later on. So things have to build upon itself. Yeah,
for sure. It takes time. It looks like Pam might be joining us here in a moment. Anna, do I have that correct? I see some chatter here over on the right.
Oh,
we only got about 14 minutes left, but it would definitely be great if she can come in because Pam is a doctor of some type. I'm not sure which type yet. So it would be really interesting to have her. I've talked to, when I lived in Portland, I worked at a hospital. It was a medical school, dental school, nursing school, hospital, VA, and it was this huge, huge thing. So I got to know a lot of doctors, med students, and stuff like that. And I could probably count on one hand the amount of doctors or nurses or whomever I talked to that were opposed to single payer. Every single other one was like, yeah, of course. I mean, it's just kind of a no-brainer here, guys. And they didn't mind taking a cut in pay and that kind of thing. Because one of the reasons why doctors get paid so much money, it's not because they don't deserve a lot of money. They deserve to be rewarded very well. Doctors are important. It's because their school loans are like $350,000 when they get done. It's ridiculous. Oh, there's somebody. Pam? Nope, she's gone.
Yeah, I'm here. Can you hear me?
Yep.
I'm here. Can you hear me? Okay.
Yep.
You're right. But the average student loan now, they said I read in the tape was $241,000.
For a student loan, like just generally?
Yeah, that's what they have when they get done with their residency.
Oh yeah, no, okay. I guess it depends on what school you go to. Yeah, because I know that I lived by Oregon Health Science University, which is a pretty good school. I know my buddy who was a med student said it was a little right around 300,000. That's insanity. And then of course there's the malpractice insurance that you have to get and stuff like that in case you get sued because you're going to get the crap suit out of you. There's all sorts of problems with the thing. So Pam, thanks for joining us. You're Dr. Pam.
I'm a
what kind? Oh, you're a pathologist. Okay, so Joy, you were correct. That's awesome.
And I direct the labs and I also read all the surgicals. I'm the one who tells the doctor what the diagnosis is.
No, I know exactly. That's what when Pam said. She's like, when Joy said, I think she's a pathologist. I'm like, I love pathologists because they're the ones doing all the work.
They're doing a lot of work. You're right. But yeah, no, I'm.
Joy, can you hear me?
Because I had another meeting, and it went.
That's okay.
Can you hear me?
I can hear you. Joy, can you hear me?
Okay.
Nimesh, Joy?
Yep, I hear you.
Okay, cool. All right, good. Well, thanks for coming in. I know you had a meeting and stuff. So, we only have 12 minutes left. Would you like to go ahead and just talk about Medicare for All, why you think it's a good idea, and
me?
Whatever.
Are you asking me? Yeah,
I
was on the Ben Churowski show twice or 3 times. So I've talked about, I'm part of PNHP, which is like 18,000 healthcare physicians and nurses and other healthcare workers who support Medicare for All. And I'm a single payer advocate because first of all, I've been a provider, so I know how and I know how all of our pay is basically based on a multiple of Medicare. And if you don't have Medicare, at least pays on a clean claim in a month and doesn't argue with you about it. So I'm also now I'm take part in Medicare because I'm a senior, and I think it works wonderfully. It's expensive though because they have to have a supplement and a drug plan, and it adds up. So it's not like it's free. And third, I'm also an employer, so I know how much private insurance costs, and how for my employees, and I know how ridiculous it is, and how it goes up every year. And the older they get, the more it goes up. And when you have good retention, you pay through the nose because you have to pay more for health insurance. But it's worth
it's pretty. Insurance companies are ridiculous. I do know. I took a couple biomedical ethics classes in college, and they were very informative. I remember one statistic, and Pam, correct me if you know better than this, but that you spend about 98% of your healthcare spending in the last 2 years of your life because Does that make sense to you? Yeah.
20% of the people consume 80% of health costs. You can look at it that way too.
Yeah, no, for sure, for sure. I do, and I definitely know people that like they kind of resent having to get health insurance because they just don't get sick very often. You know, they're just like I don't. I know about. I can think about my friend Anthony. He's like he thinks it's a total scam. Thinks it sucks. He won't get health insurance. He'd rather pay the fine at the end of the year for the Obamacare thing. It'll save him money. But then he broke his foot like 12 years ago, and he had to drop $8,000 of his own money. I'm like, see, you should get health insurance. You know, so. But
illness you can't predict. I mean,
that's to say you can't predict an accident. Yeah.
And sick tomorrow, and I mean, especially with like, I mean, we've seen this with the pandemic, but I mean, we've seen it too. So I mean, you never know when you're going to get sick, so you really have to have basic health insurance or basic health care. Not, I hate to call it insurance because I don't think really Medicare, I guess, is an insurance plan in that it's we all pay for it. And we all help insure each other.
And that's another thing too for people that are critical of like healthcare for all. Seem to think that it works differently, like logistically differently than like an insurance. Like it's the same thing. Everybody like puts in, and then you take out what you need. It's the same thing. It's just that it'd be more efficient because you're cutting out all the administrative costs and you're cutting out all the for profits for like the higher ups and stuff like that. So it becomes more cost effective and just simply fair, for all its participants. So yeah.
But also, the other. I mean, the problem is for people who believe in single payer, when we say healthcare is a human right, that doesn't play with a lot of conservatives because they don't like to hear that, even though it's so stupid not to believe that you should support everybody's healthcare, because you can't build a dome large enough or a wall high enough to keep you away from getting sick. I mean, it's just stupid to believe that you're not going to get sick and that we're all dependent. Our country is only as good as how well the weakest person in the country does. So we should be obligated to keep that weakest person healthy. So we'll be a good country.
I absolutely agree with that. 100%. Yeah. Yeah. I mean, when you're born usually in a hospital or some sort of healthcare situation is going on. And when you're sick or injured and when you die, there's probably going to be doctors around and stuff like that. I mean, so my point being is that everybody needs it at least twice in their life. So their birth and their death, and most likely in between as well. So it's not something, if you want a Lamborghini, it's on you. You just gotta have to save up and buy your own Lamborghini, because that's not a right. That's totally on you to get it. Healthcare, totally different situation. Again, you got to stop treating people like they're commodities or the effects of a commodity system, that kind of thing. Pam, do you deal a lot with? What would you say your surrounding pathologists, doctors, nurses, stuff like that? What do you think the consensus is in the healthcare system itself about single payer?
Well, I mean, they've done studies. In 2010, they did a study. In 2000, they did a study, and in 2010, they did a study. And in 2010, in fact, the average internist, family practice, general surgeon, basically, because they have to take all comers, and even pathologists were about 65% of them supported single payer. Psychiatrists supported it even more, but we did have some laggers who were like the radiologists, who only 35% supported. But I mean, I think many doctors are just fed up with insurance companies because they treat the patient and the provider exactly the same, not well. I mean, they lie to us. I mean, they give us
really,
and then if you don't watch it, they cut the rate down. I mean, I have the people from United Healthcare. Okay, Minnesota and Missouri pay the least amount for a pap smear for Medicare. So the United Healthcare guy told me that all of Southern Illinois is in Missouri's rate. Well, Southern Illinois is not a part of Missouri. And those rates were based on effects of how much things cost in Illinois. And we pay like twice as much malpractice insurance as people in Missouri. So I guess, United Healthcare, they can't even read a map. So what kind of...
That's weird. I don't know what else to call it.
It's just terrible. It's just that they lie to us. And I mean,
yeah, it is terrible.
I mean, they just do. I mean, they don't. I mean, and their ideas that they're promoting health. I mean, basically, what they want to do is drive you like I'm Medicare age. So I'm really I believe Medicare Advantage is really Medicare Disadvantage. And I was tired of Joe Namath selling it. But today I saw Dynamite Walker was on advertising it today. And I mean,
JJ Walker?
Yeah, he's advertising it now. He's
I
doing
didn't see
the
that.
commercials he's doing the commercials that Joe Namath did. And he
Okay.
It's Dynamite. But
Dynamite.
It's not Dynamite because it's managed care. And managed care doesn't work because what they want to do is manage your care so you don't spend too much money so they can retain some of the, because they're paid on a per monthly payment based on how many people are enrolled. So they don't want you to overutilize it. I mean, and that's why, like with Medicare Disadvantage, your networks, you may not get the medicine you need. You may not get to go to the hospital you want. And I mean, it's fine if you're healthy, but the minute you get sick, people want out of it.
Yeah, no, for sure. No, there's a lot of problems here. Okay, so we only have a couple minutes left, and I want to give each of you a chance to just kind of give your last statement, something, whatever you want to say, promote the march, promote Medicare for All, anything else. You want to say hi to mom, whatever you want to do. Pam, we'll go ahead and start with you since you're the latecomer.
Okay, I think we should educate everybody, and that we need to show them that we will save money with Medicare for All, and we'll save lives, and we'll have a stronger nation. And isn't that what it's all about?
Seems like a no-brainer, doesn't it? Okay. Joy, can you hear me? Joy? All right, Nimesh, go ahead. Nimesh, can you hear me?
Oh, I hear you now.
Okay.
I think this thing, like sometimes I just noticed the mute button.
Actually, I
automatically
couldn't hear you.
Okay.
Somehow, when Pam came on, I couldn't hear you at all. I could only hear Pam, so I had to use my phone to listen on the YouTube. So the name just now.
Okay, so then Joy, go ahead.
Technical.
Yeah, I know. Yeah. The loveliness of
technology. I want to say that I'm hoping that this march can be a way of helping raise awareness and getting people motivated, not to just wait on our elected officials to take action and just be complacent and just go, oh, well. No, it's like we have to keep fighting, keep pushing to make things better, especially for future generations, if not for this generation, my generation, but at least the future generations. Yeah. So hopefully everyone can come on out to our march and make your voices heard. Be loud, be proud.
Be loud, be proud. All right.
And try to make a change. Just another step.
Medicare for All, Chicago March, July 24th. Okay. Nimesh?
Yeah. Hey, just wanted to say that this thing, July 24th, March for Medicare for All, is all about two things. Keeping the flame for Medicare for All alive and well, because politicians only talk about it every 4 years. Then it's gone. Right. So we're going to keep the flame of this alive and well, number one. Number two, we're going to build a movement. Because healthcare is not about Republican, Democrat, Independent. Majority of Democrats support it. Even majority of Republicans support Medicare for All.
Really?
I mean, yeah. Wow. Something like almost 50% of Republicans support, around 85% of Democrats support Medicare for All. Right. 50% of Republicans support it. Majority of Independents support it too. Because, like Pam said, illness is something you cannot predict. Right. And people know that inherently. Yeah. I mean, people know that inherently. They have a grandma with Alzheimer's. They have a next door neighbor who has an illness. So we know that.
Yeah. People tend to change their minds about these things when it happens to them close to home. All right, everybody. Pam, Joy, Nimesh, thank you so much for coming on the show. It was a great conversation. We're going to have you all back on again. Again, this is a very important issue, extremely important. It's a matter of life or death. It really is. I mean, this is, like Nimesh just said, I mean, it's, you have neighbors, you have family, you have friends, you have loved ones. This is going to happen to everybody all the time. It's something that you just need. You deserve to be healthy, and you're going to need a healthcare system to provide some of that, at least. I mean, obviously a lot of it's not you should be eating properly, you should be exercising, that kind of thing. But there are things that are just simply outside of your control that are going to happen to you. And we can't sit there and burden each individual or families, put them in the poorhouses because they got sick. It's not right. Anyway, so it's a very much a moral and ethical question. It's not merely a matter of economics, which is that too, but it ties right to the heart of human dignity and respect. All right, thank you very absolutely.
Okay, I was going to say that haven't we enjoyed? I mean, now nobody likes getting shots, but the COVID vaccination is just an indication, an example of what healthcare for all would be like.
Exactly.
I mean,
Yes.
Right.
Shots for no. I mean, the shots are.
No, I know exactly. I mean, they bring out they bring out numbers about like the pandemic, which is awful. Don't get me wrong, but how many people die of diabetes each year?
Yeah.
Why are they? Why are they treating that the same way? Or heart disease? I mean, it's far more than 500,000. And I'm not trying to make light of the 500,000 deaths. I'm not really not. But I mean, if the numbers of deaths per year is what's concerning you, there's a lot higher death rates out there for other things. Okay, we got to go, folks. Thanks a lot for joining us tonight. I'm David Rich, host of the Green Party series out of Illinois. Till next time, be good, be green. Take care.